Cerebral palsy is one of the most common childhood disabilities, and so you will likely have contact with many families who would like to learn more about potential services and supports. My name is Dr. Leslie Pritchard. I'm a pediatric physical therapist and researcher at the University of Alberta, and I have a particular interest in cerebral palsy. In this video, I'm going to share some information about cerebral palsy and provide an overview of some of the services and supports that families might find helpful. Cerebral palsy is a group of health conditions caused by interruption to the development of the motor part of the brain. Cerebral palsy is not caused by only one thing. It can be caused by many factors, including stroke, infections that affect the nervous system, a lack of oxygen during birth, multiple births, or being born early. Children may be diagnosed earlier if they were born preterm, and they are followed by a specialized team knowledgeable about the early signs of cerebral palsy. Many times, cerebral palsy is first suspected by parents who notice that their baby feels stiff, or perhaps their motor skills are developing a bit slower than they expected. An MRI is often used to confirm the diagnosis and would be requested by a neurologist or another physician. Since cerebral palsy affects the motor part of the brain, it impacts the ability to control muscles, it affects posture and balance, and can cause muscle and joint stiffness. So it is important to recognize that each individual is affected differently. Depending on where the injury to the brain is, cerebral palsy can be present on one or both sides of the body. A helpful way to understand the movement abilities of someone with cerebral palsy is the Gross Motor Function Classification System, or the GMFCS. The GMFCS has 5 levels. Children in levels 1 and 2 walk without canes or walkers, but they may have some challenges with their balance. Children in level 3 walk with walkers or canes, and they also may use a wheelchair for longer distances. Children in levels 4 and 5 use wheelchairs to move and require assistance to move in and out of their wheelchairs. Limitations to movement can cause tight muscles and joints, and so many children with cerebral palsy will have different surgeries, medical and therapy interventions to make sure they are comfortable and able to function to the best of their abilities. Cerebral palsy can also affect a child's ability to see, hear, communicate, eat, sleep, and learn. Some children may also experience issues with seizures. Each child with cerebral palsy is different. It is important for you to understand that because someone has cerebral palsy and uses a wheelchair, they still have the opportunity to live a meaningful life. Families may want information on different types of services and supports. Funding varies by province, but generally the 4 ministries of health, education, community and social services, and children's services work together to deliver the programs that support young children with disabilities and their families. Clinicians in the healthcare system may provide services such as specialized medical and surgical services, physio, occupational, and speech therapy, as well as psychology supports. Schools may also be able to arrange services such as physio, occupational, and speech therapy for children with cerebral palsy. The focus in school is on ensuring that children can move, explore their environment, play, communicate, engage in learning, and participate in meaningful activities. There are programs that provide supports to families with children with disabilities, including assistance with extraordinary expenses and funding for respite care. Families should also be knowledgeable about programs that will provide them support for purchasing expensive equipment, such as wheelchairs, leg braces, specialized devices to assist with communication, as well as other important equipment and supplies. Children with cerebral palsy should have opportunities to participate in community activities, and so families may ask about physical activity and recreation programs. Families may look for specialized groups, such as the Cerebral Palsy Sports Association, or they may want to know about local recreation programs and their accessibility. Adults with cerebral palsy may be eligible for income support and health benefits. There are programs that provide home, employment, and community support to assist them with living and working in their communities. Navigating services can take a tremendous amount of time and energy for families. Your role in guiding them is very important. Remember that you will speak with parents at various stages in their journeys. Some parents will have just received their child's diagnosis, and this may be a very emotional time for them. Other families will have embraced their future, are leading happy and meaningful lives. They don't want you to feel sad for them. All children and families with cerebral palsy can live full and meaningful lives, and they often do so with access to the services and supports that you can recommend. This module includes a section of additional resources with more information on cerebral palsy. I encourage you to access them to learn more about how you can assist individuals with cerebral palsy and their families live their most meaningful lives.